Welcome everyone to session 5 of the Costing, Budgeting, Financing, and Delivery of COVID-19 Vaccines Learning Series. Today's session, Where Does Needed COVID-19 Vaccination Funding Come From? Is the topic we'll be discussing. My name is Bruce Struminger, and it's my pleasure to be the first person to welcome you to today's learning session. And I'll be running through a few logistic items before handing over to Angela Shen at the WHO to moderate our session. Next slide. We have interpretation in French and Spanish, so please take advantage of that opportunity by clicking on the interpretation button. It's a small globe icon at the bottom right of the Zoom toolbar, and choose the language that you would like to hear. You can select French, Spanish, or English, and you'll hear the language, one of those languages. If you want to mute the original audio, you can also click that selection, and that will allow only the interpretation to be heard. Next slide. We really look forward to your questions and comments today on the topic we'll be discussing. Please put those in the Q&A feature, which is just to the left of the interpretation icon. We'll be monitoring that and answering those questions throughout the session in writing, and some of them we'll be answering verbally through our discussion. If you have any IT or logistic issues or questions about the certificate of attendance, please put those in the chat, and we'll be monitoring the chat as well and try to help you out as best we can. Next slide. We do also have a live transcription option for English. So if you click on the live transcript option, it will run subtitles across the bottom of the screen. And if you want to hide that, just click Hide Subtitle. Next. We are recording today's session, as we've been recording all the sessions in this series, and your attendance is consent to be recorded, so thank you for that. We will have the recordings in English, French, and Spanish available, and we'll share a link to a website that Project ECHO supports for this series, and also the TechNet 21 team supports a website and archives all the session recordings, and we'll share links and access to those for you. We will be offering a certificate of attendance through the University of New Mexico, where Project ECHO is based. We'll share a link at the end of the session, about 15 minutes before the end, to a brief 3 to 4 minute survey. We really appreciate your feedback so we can better plan and adapt the sessions going forward to best meet your needs. So please take advantage of that and give us your feedback. Next slide, please. Just a note about data use. We take data stewardship very seriously, and we just want to ensure everyone that all the data you share when you register, when you put questions in the Q&A, et cetera, are stewarded carefully, and the data that's shared with WHO is all de-identified. Next slide. Next slide. Great. With that, I'll hand it over to my colleague, Angela Shen at the WHO. Angela.
Great, thanks so much, Bruce. So we'll touch base on a few announcements, run through the agenda today so you know what to expect, as well as our learning objectives, and then we'll get started. Next slide. There are a few announcements. If you go to download the slides on this, you can click the active links. TechNet has a dedicated resource page available on the Pfizer-BioNTech COVID-19 vaccines, including some training materials, training on handling and storage, both in English and French. as well as a technical brief on COVID vaccine rollouts. There are a few important reads that have recently been published. Those are also listed here. A job aid on storage and handling with Janssen's vaccine, a new language version of Sinovac's vaccine explainer, as well as some FAQs on COVID-19 vaccine and breastfeeding based on SAGE's interim recommendations, as well as lastly, publication on Janssen's adenovirus vaccine. Next slide. So today we are anchored in session 5 of a 16-session series. We're going to talk today about where does COVID-19 vaccination funding come from. Next slide. The objectives of today are to better appreciate, the agenda today is anchored in setting up the landscape around financing and the different colors of money, if you will. And today we will be highlighting both Gavi and UNICEF's process as well as approach around COVID vaccination funding, highlighting the CDS application. We'll get an update from Gavi and UNICEF, as well as here we have World Bank speaking to us today on their priorities, their financing mechanisms for COVID-19. Next slide. The goal is to review what types of funding are available for rollout, and the learner objectives are threefold: to understand public funding sources, to appreciate kind of the grants mechanisms with examples of Gavi and UNICEF, as well as World Bank funding, and to understand how the loan process works through an example with the World Bank. Next slide. I think we are going to start with a few polling questions. Is that right? Can we get those polling questions up? Okay, great. So we appreciate that you registered. We're not exactly sure who has logged on. So we have a few polling questions that we want to get a sense from you. The first question is, which organization are you mainly representing or working for? The Ministry of Health, Finance or Planning, the EPI program, the WHO UNICEF country office, or respective regional office or headquarters, Gavi, a multilateral development bank such as the World Bank or ADB or IDB, or an independent consultant. You should have a list of all 4 of those questions on your screen you can answer. I'm going to move on to question number 2 as you click. The second question is, how did you use the CDS COVAX program funding guidance, or did you use it in developing your application or as you develop your application? Yes or no? The third question is, would you agree that all the sections in the program funding guidance were relevant? Yes or no? And our last but not least question is, of those of you who are representing government, are you currently using World Bank mechanisms? Yes or no? So you should see all 4 of these questions on your screen. And I can't see the distribution yet. So I'm not sure where we are percentage-wise. Bruce, do you have a sense of where we are? I don't see it coming up, roughly at 36, great. Why don't we give a few more seconds to folks as they answer the 4 polling questions. Scroll down on your screen if you don't see the subsequent questions. And a few more seconds so that we can get reasonable critical mass. Okay, and round up those questions, and then we will have a chance to take a look-see at who we have here today. Okay, great. So why don't we take a look at the polling questions, and then we'll transition to Natalie. Could we put the polling data up? Okay, great. So it looks like you should be able to see it on your screen. We have a large proportion from the Ministry of Health, which is great, as well as EPI, country offices and regional offices, a fair number of consultants. We have about a smidge more than half of folks who did not use the CDS funding guidance document, and many who agreed that the sections in those were relevant. Of those representing government, over half are not currently using World Bank mechanisms. So thanks for those who have filled those out. If you haven't already, go ahead and we can revisit them at the end or have them. Why don't we transition to our first speaker for today? We have Natalie van der Mel, who is here to kick off the session and lay the groundwork about COVID-19 vaccination funding options. Natalie?
Thank you very much, Angela, and good morning or good day to everyone. My name is Natalie van der Male, and I work for the World Health Organization in the immunization program. Today, I'll be going as an introduction over the various funding options that we have for COVID-19 vaccination. And I believe that many of you today, if we go to the next slide, also joined us last week for the presentation. Next slide, please. For the session on budgeting for COVID-19. So before I start and review the various options of funding, I wanted to do a quick refresher in 3 points of the key points that we discussed last week on how to prepare and be ready for budgeting for COVID-19 vaccination. The 3 points were that it was very important to have a realistic plan and the cost of the plan, realistic in that it's anchored into current and projected economic environment indicators to increase the success of implementation, obviously. We also stressed the importance of trying to be involved and participate in the 2022 or future budget preparation. And that requires a bit of advocacy and active pushing for participation. And lastly, once the budget is approved and gets executed, it is important to continue surveying the budget and tracking expenditures, as well as identifying PFM enablers or possible bottlenecks that help us and help vaccinators access the resources. So this is a refresher of last week. And if we move to the next slide. Next slides, please. Thank you. On the next slide, before I go through a listing of the options, it is important to step back and understand what COVID-19 vaccination is, what function it will have, and therefore what type of funding do we want to look for to be able to roll it out. The reality is that COVID-19 is as much a health intervention as an economic stimulus. And it really is a government-wide responsibility to make sure that the vaccination takes place to prevent morbidity and mortality, as well as to allowing the economy to reopen. And as a result, when we think of government resources or government budgets, and if we think that this is a government-wide approach or operation in a way, then we are thinking about possibly reprogramming some of the funding and expenditures from other essential health and social, from other sectors and other budget programs. And therefore, the source of funding for COVID-19 should really not be coming from any essential health or social services. And because it has an economic impetus or economic function to the budget, it is not limited to looking at the Ministry of Health budget and reprogramming it, but it also should be looking at other programs or sectors. And throughout the government expenditures, identifying which areas are non-productive or non-essential activities and can be delayed for a couple of few years. Next slide, please. So there are 3 types of revenues, and then I'll go into more details on the second type. The first type was domestic revenue, which was really the budget, and I'm referring you to ECHO session number 4 that took place last week. Last week, when we looked at budgeting, we didn't stress the fact that some of the budget and revenue may also be raised through mandatory insurance contributions. Some countries have social and health insurance schemes that are important enough that we want to take them into account and look at whether this is also a possible source of revenue or budget for vaccinating against COVID-19. Now, when domestic revenue is insufficient, we turn to external funding. And here in particular, we want to flag the fact that some countries in lower and lower middle income countries are eligible for grants and concessional loans and other mechanisms to increase their fiscal space. And this is what we will be talking about today. Finally, importantly on this slide is to review the alternative financing. Last week, one question was raised about lottery or other mechanisms that countries may have decided to propose as a way of raising and mobilizing resources. And if one of your country is using this mechanism, please do share it with us through the Q&A chat, because it will be very interesting to hear from each other. I only know of Vietnam using these alternative financing mechanism. And these are typically lotteries or trust funds or other mechanisms. Now, we want to raise the fact that when we look back at the use of these alternative financing mechanisms, they tend to not be sustainable over the medium term, and they raise revenue, but over the medium term, we see that the revenue they raise doesn't continue to be additional. It tends to balance out with the original budget. So it is an option, but it is maybe it needs to be understood well and anticipated well. So if we go to the next slide, please. Again, before going through the list of options, what is quite particular or specific about COVID-19 vaccination is that it has this double function of a health and an economic function. And therefore, it is very likely that the Ministry of Finance or Economy or the President's Office leads and manage the resources that are being mobilized for the COVID-19 response. And this puts the Ministry of Health in a central role for executing spending, but not necessarily to be the authority that manages the resources. And therefore, we need to take into account that we will be receiving some resources, managing some resources, but we are very, very likely in a position to have to collaborate with other ministries and other sectors. And therefore, it's important to, in this time of scarce resources, more expenditures, likely less revenue, it is very important to think about how to effectively finance the vaccine rollout and to engage in a more active collaboration with other line sectors, so that we have a whole government approach, a whole of government approach, rather than a health approach solely. If we go to the next slide, please. Thank you. So here's my list of a very broad overview of what are the mechanisms that are there. We had discussed, therefore, government budget that was discussed last week. We did mention supplemental budgets. So in a situation where additional revenue may have been raised, either because the economy improved or the revenue collection improved, that is one source of domestic resources. We also discussed in the previous slide the fact that we can reprioritize existing budget. And here I'm stressing again, it cannot be a reprioritization or reprogramming solely from the health sector. It is an economic intervention, and therefore it is important to really look at other sector and other ministries as well. Now, when domestic resources are not sufficient, another option is to increase deficit spending, and therefore this is meaning borrowing debt, or borrowing money and increasing the debt. So when we think about deficit spending, we need to understand that while it releases resources now that I need in order to reopen my economy, it will also have an impact in the medium term because it will create debt servicing, and my budget will need to be in the future split between a greater debt servicing and my expenditures for health, education, and other sectors, obviously. So this needs to be taken into account, and it is a balance between the cost, the future cost of borrowing money, while prioritizing and making it prioritizing the reopening of the economy. Deficit financing may not always be possible for some countries because the debt level is already too high. Some countries are also close to on the border of defaulting, and therefore they're not in a position to borrow more money. And what the G7 countries and other countries did last year and this year was to use the debt service suspension initiative, which is a way of canceling the debt servicing for 1 year and postponing it to future years. It's sort of a shifting the repayment done in future years. So that's happened last year and this year. And by postponing the payment of the debt service, it means that governments were able to then use resources that would have been used for debt servicing, but for the response for COVID-19. Now, today, what my colleagues will really be presenting and talking about is grants and concessional loans from development partners. And I will not go into a lot of details here because they will be covering this section. What we didn't manage to have for this session was IMF to also explain how the SDR can be used to support the situation. Many countries had to use their reserve to pay for the response rate last year, and as a way to reestablish a balance between foreign reserves and government accounts was to be able to use SDR to draw from IMF SDRs and to increase. Now, the IMF is also working with countries that do not have IMF programs or need support to balancing the reserve, to replenishing reserves, to then channel some of these SDRs to development banks, for example. So this is also an additional source to be aware of. And IMF did an interesting podcast on this, so I just copied the link. If we go to the next slide, please. Thank you. In the previous slide, I talked about the burden of the debt servicing. And this is a chart that's extracted from a report that my colleagues from the Health Financing Department published last December. And if you see the bottom line, the dark blue, this is the share of government expenditures in lower income countries that is allocated to health. And if we look at the light blue on the top, this is the share allocated to debt servicing. So it is interesting to see that gradually it is almost equivalent how much the government spends on health as it spends on debt servicing. And this is really just to exemplify or illustrate the importance of understanding what borrowing money will imply for some governments' future spending. And if we go to the next slide, please. Thank you. So what else can be done? Because with that understanding of the different options, the key is really to first look at MOH and beyond MOH and look at government budgets and how it can be reprioritized. And to increase the efficient use of resources, be it HR or financial or other resources. And finally, to really also look at monitoring and tracking how the expenditures are taking place and keeping track of how the money was reprogrammed. And lastly, what is not there, but which is really important from the above, is that the burden of responding to COVID-19 and vaccinating against COVID-19 is very important. And all of these different options for funding COVID-19 need to be looked at together. It will not be sufficient to just use one option for financing COVID-19, but these all need to be looked at together. So just as within the government, it is important to increase the collaboration. Similarly, the government and partners need to be collaborating together. And I wonder if some of our WHO colleagues online are working, and maybe can flag that in the Q&A chat, their involvement in partner coordination work that may be led by the Ministry of Health in the country. And the last slide. Oh, that's it. So now I believe there's a Q&A session for what has just been presented.
So we're going to pause after Natalie's presentation here to see if folks have questions. I just checked the Q&A or the chat box, and we don't have any in the queue. If folks have questions, go ahead and type them into the Q&A box. And Natalie or Bruce, do we have any questions from registration? I don't believe we do, but thought I'd double check.
I didn't see any, but as questions pop up, I can also answer them online as we continue.
Great. Okay,
Thank
great.
you.
So thanks so much. So just to remind folks, as they have questions, place them in the Q&A box. We're going to shift to our next presenter on the CDS early access update. We'll stratify this first with Gavi and then second with UNICEF, recognizing that UNICEF are managing a specific subset of countries. So Lindsay, over to you.
Thanks, Angela. And just a quick check that everybody can hear me fine.
You sound great.
Great. Well, thank you very much, Angela, for this opportunity, and Bruce for the chance to be here today. Let me quickly introduce myself before I jump into the slides for everyone. And some of you we've met before on a previous session, but my name is Lindsay Cole, and I'm the head of the funding design and review team at GABI. Our team is responsible for developing the windows of funding support that many of you are familiar with, including all of the guidance and application materials around those. And then we also manage the process of application review. So when you send your applications to us, they're coming through my team. In addition to that, for those who have ongoing support from GAVI, we are involved in the review of we manage the review of all of the grant renewals, so all of the vaccine renewals, and if you have HSS grant renewals. So that's a bit of an overview of what my team does. I'm here to talk to you today about the COVID-19 delivery support window that GAVI has opened. And if we can go to the next slide, I'll maybe give a quick overview of what that is, and then talk you through where we are today and what's coming down the pipeline before I hand it over to Ronke, and then we'll have, I think, some time for Q&A. So very briefly, GAVI has decided to open, or decided actually earlier this year, to make some funding available to support the delivery of COVID-19 vaccines received through the COVAX facility. We opened a window kind of without much fanfare in March for countries that were receiving COVID-19 vaccines from COVAX but didn't have funding immediately available to get those vaccines out. And we did that largely through bridge funding. So that was mainly for countries that had existing GAVI grants through HSS grants, who needed to essentially reprogram those funds to have immediate cash available to make sure that those COVID-19 vaccine doses were getting out. In the meantime, we received a number of generous pledges from our donors, and we now have around $850 million available for delivery support through the end of 2022. So what we have done with that is to open a bigger delivery support window, which started in July of this year. Many of you may be familiar with that already. We opened what we called an early access window. All AMC 92 countries who are part of the COVAX facility are eligible to receive this funding. We have at the moment 89 active participants in the facility, and we'll see on the next slide kind of how we are managing those between ourselves and UNICEF, but essentially 89 countries are eligible to apply. Those countries were notified of the amount of funding that they could access through this early access window. And these were much larger grants than what we were initially making available through the bridge funding. And this was also new money, whereas the bridge funding that we gave support for earlier in the year was really kind of reprogramming some existing grant funding. So many countries have come through and taken advantage of this window. It's a relatively straightforward process, which we'll talk through in a bit. But the idea with the bridge funding support is really over the next 6 months, as countries start to receive an increasing number of doses from the facility, that you'll have that funding available to you to help in the scale up and to really fill in any funding gaps. We are the one important thing to say about that window is that the deadline was actually yesterday to receive those applications, and I'll speak on the next slide on what we're doing for those where we still have some outstanding applications that are expected. But just to note, for those who have not yet accessed that funding and who are interested, it's a fairly straightforward process to go through. So we really encourage you to take advantage of that window. What are we doing then following this window? We have a broader needs-based application window, which we will open at the end of September. And as you can see here, that will constitute the bulk of the funding that we'll make available for the next 18 months. It is going to be more of an application process that those of you who are eligible for GAVI grants are familiar with. You will submit to us your request. You'll need to provide us with some justification. We will do a fairly regular cycle of reviews to make sure that we are getting those through. And we anticipate that that will be a kind of 12-month time horizon from the time that you implement, looking out through the end of 2022. Maybe if we can go to the next slide, I'll talk a little bit about the current status of the CDS application. So where we are today, of the way that we have kind of managed this early access process is to divide the application process between ourselves and UNICEF, and Ronke will talk about the UNICEF piece in a second. But on the GAVI side of things, we have 61 countries who are eligible that we are managing through the process right now, out of which we've received 51 applications, which is fantastic. So congratulations to all of those who have gotten your applications in, and for those who have not yet received a response, know that those are very much in process and coming back to you with the shortest possible delay. We have dispersed, I think, to date against, I'm sorry, I'll do that on the next slide. So we have a number of these applications that we are, I'm sorry, the total amount that has come in for requests thus far is $175 million, and we have just a small bit outstanding for a number of countries who we know are working on their applications, but are a bit tied up for various very valid reasons. So what we are going to do is extend that deadline a bit further to allow those countries to come in. And for those of you who may fall into that category, you will know, you will receive a communication, kind of a tailored communication from your SCM before the end of this week to kind of make sure that we understand from the GAVI side where you are in the process, and to encourage you to come in for that request if you intend to do so and you have not yet done so. The one final thing to note on this slide is that this is a snapshot of where we are in the application process, which everybody who has access to the COVID-19 Partners platform is able to see. So if you're curious kind of where things are in process, who has asked for what has been approved, this is available to everybody through the CDS section of the COVID-19 Partners platform, which is also where you put your application. So we strongly encourage you to make your way to that site if you haven't yet done so. Let me then go to the next slide, and I'll quickly talk through where we are on with the process and what we have done to date in terms of the applications that have been received and approved. So for those of you who have gone through the process, you will know that the main pathway for submitting an application is through the partners platform. And for those who have not accessed the platform yet, we strongly encourage you to do so, to get familiar with the platform, because this is also the platform that we will use for the submission of the next phase of the CDS funding for the needs-based requests. It's a very straightforward process, which I won't go through in detail here, but you will find both the process map and the guidance on how to kind of go through the process, what the various steps are, along with the form and the programmatic guidance, kind of all in one place. You will see here at the bottom that we have, as I mentioned before, 51 applications, of which we've had 18 approved so far, which is 78 million out of 175 million worth of funding approved that has been requested to date. So we're doing quite well in that sense, and I want to really thank everybody on the call who has engaged in this process for your quick efforts. I know that it's coming at a very busy time when everyone has a lot of competing priorities. So thank you for doing that. We have almost 10 million of that 78 million dispersed, and I would expect that over the next couple of weeks, we'll see a significant uptick in the disbursement. So for those of you who have had your funds approved, but they're not yet dispersed, don't worry, the funds are coming your way, and I'm sure in the next week or two, you will have those funds out. If we can go to the next slide, I think I will then just quickly remind everybody what the CDS funding is for, and then hopefully that will kind of refresh your memory as we go into the discussion about next steps. There are 5 principles for CDS funding that we really want to encourage everyone to take on board as you're developing your applications, whether that is the kind of early access application or the needs-based application. And the first and key principle is around mitigating delivery risk. So if you have COVAX doses that you've received or that you anticipate receiving in a short time frame, and for the needs-based window through the end of 22, we really want to make sure that first and foremost, funding is going to help mitigate the risk of delivery of those vaccines. So you have the resources that you need to establish vaccination sites, get the vaccines to where they need to be, and make sure that they make their way into potential recipients. We do want, and this really speaks to Natalie's point from earlier, there obviously are a lot of funding sources out there to support COVID-19 vaccine delivery, including domestic. So we want to make sure that this funding is complementary to other funding that you have available to you. This will become in particular important for the needs-based round. So please, if you haven't already, start to do a bit of a mapping of what funding sources you have to support delivery, as we'll ask for that when you submit your needs-based application. We do want to make this funding process as light touch and agile as possible, in particular with the early access approach. And that's, for those who know Gabby, you will know that the early access window looked quite different from what we've done in the past, and that was intentional. We really want to make sure that there is some funding out there for countries who are really facing a cash crunch right now to deliver COVID-19 vaccines, while also recognizing that there are going to be some broader needs that we'll kind of look at with a bit more detail and ask for you to provide us that detail through the application. We are trying to do this in a kind of equitable way across countries and also within countries. And I think that that's another thing to keep in mind as you're developing your applications, which is really taking into consideration where the hardest hit communities are and those kind of least likely to have access to COVID-19 vaccines, and making sure that through the development of your programming that you're thinking through what activities are needed to reach those populations and make sure that they're vaccinated. And then the final piece is we do want countries to consider how you can use this funding window to expand your partnerships. And that's both at the design stage and at the implementation stage. And And so you're certainly not restricted to the set of partners that you're working with now. Obviously, that requires a lot of time and effort. And that's, again, where we would encourage everyone who is in the process of thinking through what you need operationally to get vaccines out through the end of next year to already start to bring those partners on board and have these conversations so that you're well prepared for delivery over the next 18 months, and also so that you're well prepared to come in with an application in the coming months. So with that, I'll move to the final slide, and then I'll hand it over to Ronki. So just to give everybody a quick sense of next steps, as I mentioned already, for those countries that didn't make this August 31st deadline, we have sent a communication out to you on the extension of the deadline. We really encourage everyone to come in the coming week or two, if possible, to access that early access support that we've made available. At the end of September, we will launch the needs-based window with all of the application materials and guidance. And from October onwards, we will start accepting applications. What can you do now to prepare? I think there are a few key things just worth reiterating from previous discussions. Please make sure that you update your COVID-19 NDVP. As everybody knows, there is new guidance that was published by UNICEF and WHO in early June, and that is quite key to, it takes a lot of the learnings from the early stages of the COVID-19 pandemic and the vaccine rollout, and I think will be quite helpful for you as you kind of think about the programming over the coming year and a half. Obviously, take on board all of the lessons that you will have learned yourselves from trying to roll out the vaccines. This is absolutely essential, and clearly everyone is in a very different place than they were in January when the NDVPs were originally developed. Related to that, it's imperative that you think about the funding landscape and the resources that you have available for your COVID-19 delivery. So please start to kind of put that picture together now in such a way that you'll be able to explain it well through an application, and use that as an opportunity to identify the funding gaps that you have in your programming, because those are the pieces that you'll be able to come and ask for Gavi support for through the needs-based window. All of that, obviously, in consultation with some key decision makers, and hopefully to start to talk through funding priorities. So now is a great time to get started on that. In the next few weeks, we will come back to you, and I think we're even back with a session with ECHO in early October to talk through the application process and guidelines in more detail. And with that, I will close and hand it back to you, Angela. Thanks, everybody.
Thanks so much. Great, thanks so much, Lindsay. We're going to shift to Ronki and hear from UNICEF, and then take Q&A at the end. In the meanwhile, as Ronki gets anchored and we switch to the next slide, you can also put your questions into the Q&A box. Also, a final note before we start with UNICEF is that, as with the NDVP as well as the CDS, both of those will the partners platform will be where you submit an updated NDVP as well as the application, and also to flag for you, particularly the countries that are using Civic or intending to use the Civic tool. The partners platform is also where you would upload your Civic sheets. More on the details of the needs-based application in a future session. Why don't I hand this over to my colleague Ronki for UNICEF. Ronki?
Thank you. Thank you very much, Angela, and many thanks to the organizers for having me here today. Good morning, good afternoon, and good evening to everybody joining us. My name is Ibiranke Oyatoye. I'm a health economist for the UNICEF's COVAX Act 8 team, and I will be speaking briefly this morning on ways UNICEF has been supporting resource mobilization for COVID-19 vaccine delivery in countries, as well as updates on the CDS early access application. Next slide, please. Next. UNICEF's work to support resource mobilization commenced several months ago. Next slide, please. Through what we call a Humanitarian Action for Children HAC appeal fund, we've dedicated an appeal to support access to COVID-19 tools acceleration, particularly focusing on all the pillars of Act A. And the appeal was launched for $659 million earlier this year for the current appeal year that we are in. And this fund is envisaged to fill the almost $22 billion gap, funding gap through the Act A, and is intended to be complementary to other variety of sources of funds that have been discussed earlier. Next slide, please. This is just a snapshot of what the current appeal is focused on. As you can see, there is a big chunk, about $500 million focused on vaccine delivery. This is intended to support countries on operational delivery funds, ranging from funds needed for administration, cold chain, waste management, hand hygiene, and technical assistance for vaccine delivery in countries. Next slide, please. And just a further note on the hack, as I mentioned, out of the $659 million appeal, over 77% is expected to be dedicated to the vaccine pillar. So far, we've had several donors contributing towards the vaccine appeal, the vaccine pillar for UNICEF's hack appeal. And we've been able to disburse funds through UNICEF country offices to about 109 low and middle income countries. Part of the sources of funds that have been contributed towards our appeal is the German funds through GAVI. And I will be speaking shortly on how UNICEF is supporting the COVID-19 delivery support grants for 30 AMC countries. Next slide, please. Next. So this is a snapshot of UNICEF's early access CDS application from end to end. From the start point, countries are informed of funding envelopes and guidelines. Again, these guidelines can be found on the partners platform under the specific country information. And then we move on to in-country application development, which governments lead and which is ideally participatory and collaboratory with other partners. Countries are expected to submit or upload their application via the partners platform. And from there, we screen, do quality check, and review the application. If successful, we move this through our internal approval processes. If not successful, and if we have questions along the process, we usually reach out to the countries for additional information, and we move back into the process loop of resubmitting or providing further clarification. Once internally cleared or approved, the funds are transferred and disbursed to UNICEF country offices. And in the case where there is a UN to UN agreement with regional organizations, the funds are disbursed via that mechanism. In terms of implementation and grant management, once the funds are disbursed in country, this would follow in-country processes for UNICEF in terms of grant management, in close collaboration with UNICEF headquarters. Next slide, please. So just a snapshot of the requirements for submitting an application. It's a very simple process. Two key documents are needed. One is a Word or a PDF document that articulates the funding request, and the other is an Excel-based template. The template is intended to support countries first to have an idea of the total resource requirements, any funding gaps, and then secondly, to be able to articulate out of the funding gaps what the countries would like the CDS to support. Next slide, please. So just one of the few reflections we've gotten from the templates deployed, very few countries we've noted have estimated a total country resource requirements using the Excel budget template. And only one country was able to present a multi-year funding requirements and funding gaps. We are very interested to hear from countries on their experience from using this template, particularly countries that haven't already completed the civic costing or any other national costing exercise to understand resource requirements to deliver COVID-19 vaccines across the years. We do envisage that additional technical support might be needed for countries, but again, we are very interested to hear your experience if you've been able to use the template. Next slide, please. So very briefly, just to show that we have a range of cost categories or budget items that the CDS is supporting. Currently in the UNICEF template, there are about 17 categories in addition to administration funds. You can see from the applications received so far, we've analyzed about 22 country applications, and countries are requesting funds across all these categories, with certain categories are very highly demanded. So that includes cold chain and human resource costs. Next slide, please. This is showing, again, the disaggregation of the data by NDVP areas. We can see from the slide that areas of high need and high demand continue to be vaccinators and vaccine delivery, cold chain. And within those buckets, there's a high demand for vaccine transport, per diem to cover the time of vaccinators for outreaches, human resource surge costs, and also cold chain equipment. Next slide, please. And this just gives a snapshot of the proportion of aggregate funding that again has been requested for the various buckets of costs mentioned before. Again, about 70% of the aggregate funding requests received so far has been focused on funding dedicated to ensure outreaches, ensure cold chain equipment are in place, ensure that there's adequate human resource, and ensure monitoring and evaluation in country. Next slide, please. In terms of where we are currently, we've received 24 applications as at yesterday. As at this morning, that has increased to 25. We have reviewed and approved and disbursed funds to 9 countries. The remaining countries are still in review. We are still expecting 5 countries to submit application to us. The deadline for the UNICEF application is today. So if you are planning to submit an application and you've not already done so, please hurry up and make sure you apply today. In terms of next steps, similar to what Lindsay already described for Gavi, we will be communicating with countries in the next few weeks with a view to open the needs-based application window between October and December this year for application. With that, I'll hand over to Angela, who will be moderating the questions and answer for this session. Over to you, Angela.
Great, thanks so much for informative session, both from the Gavi side as well as the UNICEF end. It looks like folks are putting in some questions in the Q&A. I see hands up, and so if folks can put in their question into the Q&A box, it would be great. It looks like folks are taking down their hands, putting in the Q&A, and right now Lindsay is typing in a answer around, can technical support funds requests include TA for strengthening management of the use of funds, such as assessing capacity of implementers and operational pieces. So you can go to the Q&A, stick in your questions, and we can either answer them live, or as folks put them in, we'll have a written response that is transcripted as well. So Do we have any other questions? Please put them in the Q&A box. And why don't we slowly transition to the next speaker? I don't see any open questions out, and I don't see any hands remaining. So our next speaker is Michael Kent Ranson, who comes from the World Bank. Kent, hand over to you. Kent, your slide is up, so hopefully let's see if you're on mute.
Thanks, Angela, and hello, everyone. I hope you can hear me. So I'm a senior health economist with the World Bank. One of my roles has been to serve as a liaison between the World Bank and GAVI and COVAX over this last year and a half since its inception. I also work as part of one of our country teams, the Tajikistan team. So you'll hear me refer to some of our work in Tajikistan in this presentation. If you go to the next slide, please. So the World Bank group was founded in 1944 to support post-Second World War reconstruction. The World Bank has two goals outlined in the slide: to end extreme poverty by reducing the share of the global population that lives in extreme poverty, and promoting shared prosperity. Back in 1990, some 36% of the population was living on less than the equivalent of $1.90 per day. This number had dropped to 9.2%, and it seemed like we were on the right trajectory towards achieving this goal of having less than 3% under that level of $1.9 per capita per day. However, the COVID-19 pandemic certainly threatens to reverse this progress. The World Bank earlier this year estimated that up to an additional 150 million people could be pushed into extreme poverty before the end of 2021. The World Bank group aims to address these twin goals through its 5 agencies. And I'm going to talk a little bit about the work of 4 of these in particular. The International Bank for Restructure and Development, the IBRD, lends to governments of middle income and creditworthy low income countries. The International Development Association provides credits or loans and grants to governments of the poorest countries. And I'll be focusing on IBRD and IDA in particular today. But I do also mention the work of the International Finance Corporation, which provides loans, equity, and technical assistance to stimulate private sector investment in developing countries. And I'll also mention in passing MEGA, the Multilateral Investment Guarantee Agency, which provides guarantees against losses by non-commercial risks to investors in low and lower middle income countries. If you go to the next slide, please. Next slide. So the World Bank Group has deployed over 157 billion to fight the COVID-19 pandemic's health, economic, and social impacts over the last year and a half since April 1st of 2020. This is the largest crisis response of any such period in the World Bank Group's history. I'm going to focus in later slides on the IDA and IBRD response. That's where you see the overview in this slide. Also to mention here that the International Financial Corporation is providing support for expanding the production of vaccines. This is part of a broader effort to expand pharmaceuticals, medical technology, and health services for the COVID response. And I won't say much more about the work of IFC and MEGA. I'm going to focus on our grants and loans to countries, and we'll be focusing in particular on the health sector response. If you go to the next slide, this just shows that across the World Bank, we've been working on the COVID response through partnerships in order to best support our client countries. at all stages of the vaccine chain. So we've partnered with the private sector through those IFC investments and contracting negotiations, with WHO and ACT-A partners and donor partners to support financing and readiness for the deployment of vaccines. And our convening role has been formalized recently through the establishment of a World Bank, WHO, IMF, and WTO task force. And there's a little information in that slide about that task force. If you go to the next slide, please. So this is just to illustrate that bank support to our client countries is a continuum in terms of how countries are categorized and the pots of financing for which they are eligible. On the left, so eligibility for IDA support depends first and foremost on a country's relative income, defined as GNI per capita, below an established threshold, and that's updated annually. For the current fiscal year, the threshold is $1,205 per capita. IDA also provides support to some countries, including several small island economies that are above that income cutoff, but they lack the creditworthiness needed to borrow from IBRD, Fund for Middle Income Countries. Some countries, such as Nigeria and Pakistan, are IDA eligible based on their income level, but they're also creditworthy for some IBRD borrowing, and they're referred to as blend countries, which are shown in the middle column in this figure. So on the left-hand side, you see that currently there are in the current round of IDA, which covers our fiscal years 2020 through 2023, there are 74 low or lower middle income countries that are IDA eligible. And the pot of resources available for that 3-year period was $82 billion. And that's to be provided as grants or highly concessional loans called credits. And then as I've mentioned, there are the blend countries, which are IDA eligible, but they can also borrow on IBRD terms. And there are 15 countries that currently fall into that category. And then over on the right-hand side, you can see that there are 70 countries then that are eligible for IBRD financing. The World Bank also provides grant financing through trust funds, which I've listed at the bottom of that slide. So that's funding that's also available to client country governments through the World Bank. If you'd go to the next slide, please. So this is then to illustrate the funds so far that have been made available for the health response. Starting back in April of 2020, $6 billion of financing was made available for the initial phase of the COVID response, and that was made available through a fast track facility under which some 86 projects were approved. In the initial phase, this was largely financing for PPE, diagnostics, and for therapeutics then, or providing medical supplies and equipment, for example, for intensive care units. In October of 2020, then an additional pot of resources, some $12 billion worth of financing in the first instance, was made available for the vaccines response. That has recently been increased to a total of $20 billion worth of financing. And so far, this supports projects in 54 countries. And I'll say a little bit more about those. There are some other COVID-19 resources available for the health sector through restructuring or redeployment of existing projects. And through trust funds, as I mentioned in that previous slide. If you go to the next slide, please. This illustration just shows a typical project cycle And I wanted to mention here that World Bank financing fills gaps that are identified by our client countries. Governments ultimately decide what they want to request funding for. And once they've got that funding, how it's going to be allocated. I'm going to talk a little bit about how that works for the vaccine response projects. We've highlighted here that the time from initiation of project preparation through to approval of projects, that is World Bank approval of projects, is currently averaging 2.5 months for the COVID response projects, which is a remarkable achievement for us insofar as traditional projects, not under this umbrella of the COVID response, to take on average 1.5 to 2 years. So we've significantly shortened that period as part of this response. Next slide, please. So this shows that 54 countries so far have benefited from vaccine response operations or projects across every region, and that was as of last week. More than half of the approved projects are in Africa. So far, of that 20 billion pot of resources that I mentioned before, 4.6 billion of that has been approved for projects. As well, there's an additional 1.6 billion worth of resources around projects that are in pipeline and that we expect to be approved by October of this year. As I mentioned, there has recently been an expanded commitment, which extended the commitment from 12 billion up to 20 billion of financing available through until the end of calendar year 2022. There, if you go to the next slide, please. So those resources for the vaccines response then are available for countries to use either for purchasing vaccines or for any aspect of preparing countries to be ready for the vaccines and their deployment. In terms of procuring vaccines, so the World Bank financing can be used for procurement directly from pharmaceutical manufacturers, but we also support certainly procurement through pooled procurement arrangements like COVAX. There's a new World Bank COVAX financing mechanism through which countries can use World Bank financing to procure vaccines. That is something that arrangement's just been finalized within the last couple of months, and already there are some 9 countries that are purchasing Moderna vaccines through COVAX using that cost-sharing arrangement, and more recently there are several purchasing Sinopharm vaccines through COVAX. If you go to the next slide, please. There's also a regional procurement mechanism in the run by the African Union. And this is the African Vaccine Acquisition Task Team. World Bank financing can also be used to support procurement through this mechanism. Currently, there are some 35 countries with World Bank operations that have requested a total of 200 million doses through this mechanism. This AVAT supplies complement donor-funded doses, or doses to complement those that are available through COVAX. So both the fully donor-financed doses through COVAX, dose donations through COVAX, and then any vaccines that have been procured either through COVAX or through bilateral arrangements with manufacturers. If you go to the next slide, please. So I've got a couple of slides here just to give some sense as to how funds end up being split between procurement of vaccines and deployment, and to give some flavor as to some of the deployment investments that countries are making. First on Tajikistan, and as I mentioned, I work as a part of our country team in Tajikistan. A project there was approved for some 8.6 million US dollars back in February of this year. At the time that that project was planned, prepared, it was anticipated that about 2/3 of the financing was going to be used for procurement, with the balance used for deployment. However, as financing required for cost sharing through COVAX ended up being higher than was estimated, it's ended up being the case now that 83% of the project has been dispersed for vaccine procurement through COVAX cost sharing, and with some 1.5 million, as shown on the figure here, that's not yet allocated. As well, we're under discussion about the possibility of an additional financing package to the government there. So this was to highlight that what you'll see, and we've provided links to project papers across the 54 countries that show the amounts that were budgeted at the time that projects were prepared. This slide illustrates that those figures budgeted are in many ways illustrative, insofar as World Bank financing is really very flexible. Once it's in the hands of our client countries, it's quite easy for them to reallocate within the vaccines response. And that was the fast track facility for the COVID response was designed to allow that sort of flexibility. If you'll go to the next slide, please. This gives some snapshots of approved operations or projects in several other countries. So Bangladesh has received 500 million worth of IDA concessional loan or credit, and that they plan to use that at the time of project planning, roughly 80% for procurement and 20% for deployment. And you can see some of the deployment activities there that were planned, including cold chain strengthening, in-country vaccine transportation, as well as other operational costs. Indonesia, which has a higher GNI per capita, availed of 500 million worth of IBRD loan, and planned not to use any of this for vaccine procurement, but to use the entire amount for deployment and for health systems strengthening. And again, you can see some of the items there that they intend to invest in, including pharmacovigilance systems, supply chain and logistics, HR capacity building, and so on. Côte d'Ivoire, like Bangladesh, availed of an IDA concessional loan in the amount of 100 million. And the plan there was to use 2/3 of that for procurement and 1/3 for deployment. And again, we've given some examples there as to some of the delivery activities that were anticipated with that financing. If you go to the next slide, please. So we continue to work with countries to ensure that they've got adequate resources, as I mentioned, both for procurement and for deployment. I just wanted to highlight, I suppose, in the right-hand box there, that currently, on average, across the 54 countries where there are approved projects, the plan has been to spend about half of the resources on procurement of vaccines, 30% on deployment and other health system strengthening activities, and 19% on other activities, some of which are quite directly related to deployment and include, for example, PPE and diagnostics, some of which will be used by healthcare workers in vaccination clinics, for example. Go to the next slide, please. So some of you will represent ministries of health and finance. You are our client countries, and you're surely in touch already with task teams in country. I think here I wanted to highlight what partners beyond our government counterparts can do. So we rely on COVAX partners and others to support countries in developing national deployment and vaccination plans, and of course to revise those as guidelines, for example, out of WHO in terms of what percentage of population should be vaccinated change. We also rely on partners to, of course, deliver technical assistance in areas of their comparative advantage. And we've been hearing about some of the work that both Gavi and UNICEF have been doing through their CDS investments, and in particular on cold chain, and certainly an area of comparative advantage within those two organizations. Also, we depend on partners to provide complementary financing, both for vaccine procurement and for deployment. To share this information, as we also commit to do, through national platforms such as interagency coordinating groups or their equivalent across countries, and also through the WHO partners platform, so that we have visibility in terms of what government is able to finance with its own resources, what the gaps are, and then what different partners are providing financing for, and recognizing that it's a fast changing situation, that available resources are also changing from month to month. So much of this is a sort of real time discussion around the table at those interagency coordinating groups or donor coordinating committees, or however they're called in your particular country. Finally, we've provided links in an annex here to all of the project papers or project appraisal documents. Those are available for the World Bank through the World Bank website, and are regularly updated also in the WHO COVAX Partners Portal. I think that's it for my presentation. The only remaining slide is the one that shows the 54 approved projects with the links to their project papers. Thank you. Angela, you're muted.
Great, thanks so much, Kent. We have two questions that are queued up for you. One of them is for the World Bank. Can IDA resources be used to pay salaries for vaccinators? Kent, that's over to you. And you're on mute.
Yeah, so there are quite strict rules about what the IDA resources can be used for in terms of health worker salaries. And I think it's generally expected that government is paying for the salaries of health workers who would already have been in place. In countries where the health workforce needs to be ramped up with temporary community health workers, with consultants brought in, then World Bank resources can be used for that, but not for the salaries of health workers who were already in place. I think in cases also where health workers are having to work overtime or to travel extraordinary distances to deliver COVID vaccination, but the World Bank can also fund those activities.
Great. Thank you so much. The second question we have for you, Kent, is the World Bank advising countries to use some of their SDR allocation to increase health spending in light of the crisis? You can also see the chat, the question written in the chat if you want to, in the Q&A, if you want to see it written down. But the second question is over to you, Kent.
Sorry, I didn't. Can you repeat it, Angela? Can you?
Sure, it's in the Q&A box, and it's about, is the bank advising countries to use some of their SDR allocation to increase health spending? You can also think about that, Kent, because we can do written responses for anything that we haven't reconciled.
Let me write in a response.
Sorry?
I'll write in a response if you give me a moment to think about that.
And we have 2 more questions for you if you wanted to move on to the next one. So the next question we have, Kent, is, I'm not sure if you can see them, is of the 4.6 billion in World Bank financing commitment to support rollout, when is the expectation that all of the funds will be dispersed and accessible in the 54 countries who had received approvals as of the end of July? And you're still on mute?
So for the 54 countries that have approved projects, the bank has finished its approval processes. It's then up to the country to make the funds effective. That sometimes requires approval within different ministries.
Refresh, you can do. There you go.
Can you hear me?
Yes.
So for the 54 countries, there may be processes in country required to make the financing effective. For more than half of the countries, I believe the funds are already effective. They're available for use. In some other countries, there are still in-country approvals, signatures by different ministries, or parliamentary ratification required before the funds can be used. It's in the hands of the client countries, their governments, then to make those funds effective. In terms of disbursement, these COVID response projects generally had they've got a 2-year lifespan. So we anticipated that most funds will be dispersed in a front-loaded manner towards the beginning of that 2-year period. The funds should generally be completely dispersed within a 2-year period after approval.
Great, thank you for that. The last question is in French, and I don't speak French or read French. So perhaps we could do that offline when we follow up. Kent, any last comments on, we have time for one more question, which another one has come in also in French, so we can certainly follow up on that in writing. Any last comments, Kent, on the use of SDR allocations or any other remaining comments in general?
So I think the question in French, I think, was about the possibility of using the finance for demand generation, financing around hesitancy, I believe, and certainly bank financing can be used for those activities. And I think in some of the country examples I gave, they may have mentioned activities like that.
Thanks so much. So we'll answer the remaining outstanding questions as a follow-up from this webinar, which also will include transcripts and slides. Let's shift to the closing for the poll questions. Can I have the poll questions up? Great. So we have 3 poll questions to end today's session. The first is, did this session help your understanding of World Bank financing for COVID-19? Yes or no? The second question is, this session helped me find additional information on how to use the Partners platform to request CDS funds? Yes, somewhat, or no? And the third question is, I plan on submitting my CDS early access application. The answer choices are I already have. The second is this week. And the third choice is next week. Hearing from Lindsay that Gavi is expecting a number coming in because of understandable delays. So there are 3 questions in the poll. First around bank financing and understanding. The second around additional information on the Partners platform to request CDS funding. And the third is around your plans on submitting your early access application. So go ahead and click those and let's see what we get as we are closing up the session. I can't tell our completion rate yet, but let's give it a few more seconds. Okay. Echo, could we take a look-see to see what the responses are? Great. So fabulous. So we see a high proportion of folks found this helpful in understanding bank mechanisms, as well as with regard to finding information on the CDS application. It looks like half our participants have submitted their application, with a good portion planning this week and next week. Thanks so much for that. Next slide. Next slide, please. If we can get to the next steps, it's probably a few slides over. Perfect. Next slide. So I want to let folks know that they could find all the recordings, webinar slides, webinar materials on the TechNext site, as well as continue to ask the questions that you have, as well as share your experiences. The links are there. I want to make sure that I thank all the translators for their simultaneous translation, as well as the efforts that we have for the functionalities like live translation and live transcription. Next slide. Our next session, as well as our subsequent sessions, you can see on the registration site you can register for. As I mentioned in the chat and Q&A boxes, there'll be a fully dedicated session in October, beginning October, on the details of the needs-based core application, both from Gavi as well as UNICEF. Our next session begins a series of regional-based country learnings, for which we'll be kicking off with regional country learnings from the Afro region. That's next Wednesday on September 8th, and you can register for that as well as subsequent sessions right now. Next slide. Thanks so much. Any questions that we did not answer today during the session will be shared via the technical experts, answered via an email. Thanks so much for joining us, and have a great morning, afternoon, evening.